Welcome. Thanks for coming, and thanks everybody else who are at the satellite locations. My name is Dr. Blacksmith. I'm a psychologist at Northeast Behavioral Health. I work with ages babies through adults. Today I'm going to talk with you about screening for adverse childhood experiences in an integrated system. I'm really excited about this because we're going to actually start screening at Northeast Behavioral Health or Northeast Missouri Health. We're going to start screening all adults for ACEs. So I'm going to share at the end how we started that, what we're going to do, and what that looks like playing out live in an integrated system. I do have a few, there's objectives. I'm sure everybody saw those. I'm not going to go through those due to time. I do have a disclosure, so some stuff I will talk about today does include childhood trauma, and I always add this in my, or I've been adding it more often in my presentations just because it could trigger something within somebody. So if you feel like you need to step out, please do. I am going to start with an activity that I've never done before, but I have a colleague who does this, and I think it's really, it's a good one. So this is from Chaddick. I want to give them credit for it. And so this is a nursery scene, so if you would please join with me, I'd like you guys to close your eyes for me. And we're going to visit two different nurseries. So the first nursery we walk into, we see a mom and dad peering over the crib, looking at their little baby. A little while later, we hear baby crying, and mother has come to see what is the matter. She decides that he may be wet as he's just woken from his nap. Oh no, that's not it, so she begins to feed him. Ah, that is what the baby wanted. A little while later, we see the father burping and then changing the baby after mother has fed him. He is now content and ready to play. Mother and father spend time looking in his eyes and coo back to the baby who is gurgling and smiling at his parents. Father enjoys playing peekaboo with his little boy, which makes the baby laugh out loud. His parents respond with coos and laughs of their own. They continue playing. However, the baby begins to rub his eyes and starts to make some different noises. Mother and father see this as a cue. The baby may be sleepy. Mother begins to rock and sing to her little boy, which settles him down and calms him. Father takes his boy and lays him gently in his bed for a nap. His parents then peer over the crib, watching him as he drifts into a peaceful sleep. So just kind of keep in mind, how does this child feel? What does he think about his world? And what does he think about himself? So the next nursery we're going to go into won't be as pleasant. There's a slight odor of spoiled milk and dirty diapers. We hear a baby crying, almost whimpering. We peer over the crib to find a baby with a tear-stained face and his eyes tightly shut. He does not notice that we are standing there. His diaper is obviously full as we see the bed sheets too are wet. He is clutching to a bottle lying next to him, empty. On the floor next to the crib is a full bottle, spoiled. Looking around the room, we notice that it is dark and disarray. Looking around the small apartment, we walk into the next room, where lying on the couch is a young woman. She is sleeping. Lying next to her is also an empty bottle. She also does not notice that we are standing there. She appears disheveled and incoherent as we try to rouse her. So think in your mind, how does this child feel? What does he think about this world? And what does he think about himself? So you guys can open your eyes. We're going to go through, so keep that in mind as we go and talk about the importance of brain development. I don't know how much training you all get in brain development with babies and the impact it is on the limbic system if they've had trauma, but their brain's fully developed by 90% developed by age 3. So any baby that's endured that example nursery B, that could impact them the rest of their life. And we'll talk about most likely what kids behave, look like, act like when they're preschool age, and how that impacts their development. I'm not going to play the video on here just due to time, but this is a really good video, really self-explanatory on just the developing brain and impact of toxic stress. And I did add a page PDF that you all should have received about the importance of knowing that pregnant moms the toxic stress within them when they're pregnant, how it does impact the developing brain. And this slide right here just goes to tell how the brain's developing when the baby's within 3 weeks, and it goes through all the way to birth. So I'll talk later about the impact of the ACEs on mothers and how that impacts children and childhood. And then I talk about how The frontal cortex, that's not fully developed till 25 or 30. So if you have kids who endure any neglect, trauma, witnessing it, and I'll talk about the different types as we go on, their limbic system is overworking, overproduced, and that hinders the development of their cortex, the one that goes to problem solving, thinking, logic, reasoning, and anything could easily trigger a child who's had any neglect and trauma, and then that comes out their animal instinct, that fight, flight, freeze. So that goes back to the serve and return. So if we had nursery A, nursery B, nursery A did receive the serve and return. The cooing, the looking back and forth, the eye contact, meeting the baby's needs. The nursery B did not get that, and that's what we call toxic stress. I'm going to show a quick video.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, come on, why aren't we doing this? Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it, they actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
Like he said, so if the baby's stuck in that, I guess you can call it the red zone limbic system, that's the fight, flight, freeze, help me, get me out of here, that is overdeveloped. And that's when you see kids who have that extreme neglect, trauma, parents who have any postpartum who are not able to be there for their baby, that disrupts attachment. So oftentimes, yeah, any child that has those behavior problems, emotional outbursts, always have to look into what is any trauma, neglect, and then the parents' own mental health. But like he said, once in a while, it's okay for children to kind of feel that, I guess you can say, stress. But if they're in it too long, then it starts damaging the brain. So I'm going to go into talking about trauma, what that is, and different types. So over 35 million children are suffering from childhood trauma. So it's an experience that is emotionally painful, distressful, or shocking, which can result in lasting emotional and physical effects. So these are just some types: neglect, abuse, attachment, medical, and other. I add on medical trauma Because I've had some parents tell me, because I've been doing it for a while now where I have different experiences in different states, and I've worked in schools and hospitals and now an integrated health system, and I've had a few parents tell me that they've had some providers, doctors tell them when their babies go through an intense medical procedure that their baby won't remember it. It's actually not true. That you explicitly, I don't talk a lot about implicit, explicit memory, but explicitly no, the child won't remember that they actually went through this intense surgery, medical procedure when they were a baby. Implicitly, they could. So implicit is, I walk into a doctor's office, I walk into a hospital, I don't know why, I don't know, my kid's having this meltdown, this tantrum. It could be the smell of just the hospital. Implicitly does not make them feel right, which could be related to that surgery they had when they were 9 months old. Does that happen all the time? No, but it's always thinking that, yeah, the medical trauma is a big one with kids who've had any surgeries, born premature, and just significant health issues. The ones I see often are complex trauma, and we have a lot of children who have complex trauma, children who in the foster care system, children who are adopted. All the time, no, but 95% of the time, yes. And then they generally develop ways of coping that are survival, and they're healthy for them in the moment because they're trying to survive. But you take them out of that environment, they're still in that system. Their brain developed grooves. That's a kind of simple way to explain to parents who've adopted or fostered, that these grooves have developed where they are surviving, they are doing what their brain is telling them to do, even though they're not in that environment anymore. And it could take years for them to get to a place where they feel safe, that they can trust. So yeah, these are just different possible origins of complex trauma. The ones that I generally see, like I said, are the neglect, witnessing violence, witnessing parents fighting, and then the just parents with substance use, alcohol problems, and the chronic invalidation. And so chronic invalidation, I don't think it's talked about a lot, but I have a lot of adults I work with, and I see children with it, especially with parents who've had their own trauma or their own mental health. But even if there isn't significant trauma in mental health, I see a lot of adults who talk about how they didn't get their emotional attunement from their parents when they were younger. So emotional neglect is you're not giving what the child needs. So you're not meeting their emotional needs. So an example would be when the child's crying or upset. So invalidation is you're fine. You're completely fine. Get over it. Every once in a while, is that okay to say? Yes. But if it happens often, that's what we call emotional neglect. And so I'll have adults say that they don't know why they feel the way they do, or they don't feel, even though they're very intelligent, very successful, they don't feel like that. They feel like a fraud. So that goes back to not getting the emotional needs met. And this is so important because we now know emotional intelligence is more successful in life than your IQ alone. So it's good to see that some schools are starting to add this in, and I do this a lot with my parents and my adults I work with, just because it's so important. The tricky part is that you have to actually model it and show it, because if you didn't get this as a child, you're not going to be able to give it to your kids unless somebody explains to you, you didn't get this, this is what you do, this is how this looks. And so it's also emotion hides behind behavior. Anytime I see children, really any age, but mostly children and teenagers, if the behavior is what we see, but what's the underneath that we don't see, the emotion. So what is it anger? Is it sadness? Is it alone? Kind of, those are the main ones that I see a lot. There's a lot of teaching. And then the negative belief that they carry with them. And so like I said, I work with all ages. So a lot of times I'll have adults who still believe these beliefs when they think of that trauma they experienced. So I'm never safe, I'm unlovable, I'm a monster, I'm a failure, I'm helpless. A lot of shame is carried with it. Children especially, their internal working model, I talk about that a lot with families in schools, that the way we talk to children, the way we experience emotions with them is how they start to believe who they are. And if that's in that neglectful, it could be emotional neglect or having that trauma happen to them, I see this very common, that I'm not good enough, or there's something wrong with me. And so you have to process that in order to heal from that. And there's different types of therapy that work really well with that. And there's some that are that do more harm than good. And at the end, I have a list of different therapies just for your reference, so you can have an idea of what's helpful and not helpful you refer patients on. So like I said, it causes people at any age who've experienced trauma to live in that fight, flight, or freeze. They have a short attention span. When you're in, I do it really simple. So it's the blue, green, yellow, and red. The blue zone, which I think I have so the blue zone is when you're on shut-off mode. So you're sad, you're down, your body's limp, you're not making good eye contact, you're just in that dissociative state. The green is where you learn, you're able to have communication, you're calm, you're able to think logically. The yellow, which isn't on here, is for kids, you might see them start acting silly, moving around a lot, start yelling. Adults, you might yelling a little bit, you're still kind of functioning. The red zone is when you're stuck in that limbic system. So you're on fight. You want your anger, extreme anger, aggression, complete meltdown tantrums. So thinking of little 2- and 3-year-olds who have their meltdown tantrums, talking to them does not work. So you have to wait till they kind of get back to the yellow-green before you can actually calm and sit with them. This is the same with adults. So adults who've had trauma in their childhood and adolescence, if they haven't worked through it, they will be on the same kind of thinking pattern. And a lot of times it goes straight from blue to red. There really isn't even in the middle. And that's what I get a lot from parents with children who've had extreme trauma and neglect, is that they say there is no middle. My kid goes from here to here. So it's really trying to figure out where they're at on this. I guess you can call it the window of tolerance, and you're slowly expanding the window of tolerance so they can experience different situations. And then this is an important one too, unable to develop healthy relationships and distrustful of others. So in schools, I'll have teachers who just don't understand why this child is acting this way, why all of a sudden things were going fine, and then they act up and they blow up and they rip their papers, throw their desk, and it's because of that internal working model. So this feels good to me. I don't really know why they're treating me this way. Something bad's about to happen. I better go ahead and do this before the teacher does it to me. That happens a lot in schools with teachers. That happens even with foster parents and with adoptive parents, because in that internal working model, it was chaos. It was a lot of stress, and that's what they know. So you'll see kids create that stress, create that chaos, because that's what they learned to do when they were in that survival mode. So throwing a punch makes sense if they're jumping to defend their parent from an alcoholic, raging parent. Screaming in fury is a normal reaction to a bully who continuously harasses them. This picture just shows how impactful trauma is on the developing brain. So on the my left, I guess it would be a healthy brain. So you can see all different activations. Temporal is that social, that emotional part. It's on the left when you can see it's not as developed. So there's brain scans that even show and MRI scans that show just the activity in a brain is different with the child who experienced trauma and neglect. It even goes as far to show that you can see different parts of the left brain for language. It's developed. So anytime I have a child that's had trauma and neglect, I'm always suggesting the parent have them go through a good psychological evaluation so you can get an accurate diagnosis, learning disability, and treatment plan. So crucial. And then this is in Bruce Perry's book. He just shows what a normal developing typical brain looks like compared to extreme neglect. So they're just not the same size. And like I said, the limbic system is overdeveloped. It's completely going and on stress mode, while that cortex, that I call it simply, is hijacked. Can't get to that thinking brain, and a lot of times it's like an animal instinct. They're living in that punching or that fight, or completely the other opposite, which I don't think I've talked about, is dissociation. So dissociation is very common in children if they've had extreme trauma and neglect. And dissociation is when they completely shut off their brain to go into a make-believe world. And that's survival mode. So they're getting through that moment. And then if they continue to do that from birth to 3, that's since the brain's 90% developed by age 3, that makes their chances of developing dissociative identity disorder, which used to be multiple personality disorder. That's kind of where that came from. So anybody with these multiple personalities, they've taught themselves to get through that trauma, that neglect, protecting themselves. But of course, it's not healthy when you're not in that environment anymore. And it's extremely difficult to treat in adults. Children, it's easier, it's still difficult, but adults, it's a little more difficult as their brains fully developed. Any questions so far? No? Okay. So most trauma victims do not seek mental health services. Instead, they look for assistance and care in the primary care setting. So have you guys experienced people coming in with, I guess, right here, hostile, irritable, missed medical appointments, no-shows, confused, not following through on their treatment plan, maybe even yourself feeling stressed and overwhelmed with this patient because they don't listen and it's the same problem over and over and over, acting in certain ways out of anger or completely shutting down for certain procedures. I know women who've had any sexual assault or sexual abuse history. Going to the OB is a big deal, and a lot of them avoid it. And even with their pregnancy, there's a few that have not waited until they were 37 weeks pregnant. The first checkup they've had was they were 37 weeks pregnant because of their past trauma. So this leads me to adverse childhood experiences study. Have you guys heard of this study? I know the ones that have worked with Dr. Ioannis, I've talked about it often, and I'm sure you all heard of it. I am going to play Dr. Nadine Burke's video, just the first part of it, since she's the one that's sort of the lead and where we're going with it now in the United States.
Did you hear this week she was appointed by the governor to
I saw that. General, yes.
Surgeon General
Yes.
of California?
Yes, it's amazing.
So good.
Yeah, it's awesome. I actually went to the ACEs summit in California in October and got to hear her speak and learned a bunch of, it was amazing. A lot of the pediatricians that were there and everybody who's starting to learn about ACEs, and so it's pretty cool. Just due to time, I don't want to go too much into detail, but this is a background for why Dr. Felitti and Anda, they started an obesity clinic in the 80s, and what they found was a lot of their patients were losing the weight, but then they gained it back. So they started looking more into the questioning and asking about their past, their history. And what they found were a lot of the patients had a sexual abuse history, trauma, neglect in their history, and that was triggered enough for them to gain the weight back. So obesity is very highly correlated with abuse and trauma. And that led them to, fast forward, it led them to the ACEs study, which they did with 17,000 adults. And I'm going to play this video. I won't play all of it, but if you want to go back and look at it, I think you should. It's really good.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or a packaging chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California, and together we opened a clinic in Bayview, Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle, and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, "Dr. Burke, have you seen this?" In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand better than we ever have before how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis.
I'm going to stop it, but I recommend watching the whole video. She goes into more detail about the study. I also have it on your slides. And you should have received this through the handouts. This is the ACEs questionnaire. So these are the 10 questions that she was talking about. And so simply giving this to somebody and asking them from birth to 18 years old, how many of you experienced, put a 1 by it if you have, a 0 by it if you haven't, and in total your score at the end. And what she said in the video was 4 or more correlated with these different behaviors and physical and mental health outcomes. And just research keeps coming in on this, and that's why a lot of pediatricians are starting to screen for this in children and families. 20 years life expectancy decrease if you have 6 or more ACEs. Students with 3 or more ACEs are 2.5 times more likely to get a failing grade, score lower on standardized testing, language difficulties. And then the end of the video, she talks a little bit about this, but epigenetics. So knowing now there's research coming out that mothers who have a 4 or more ACE score, higher chance of having behavior problems in their children, having mental health in their children. And then just carrying on, and that's where we see that intergenerational. It just keeps going unless it stops either with counseling, therapy, or appropriate resources. And then ACEs is being used. There are a few states that actually have their trauma-informed states, and they're screening in all medical locations, and they have some residency programs where they have a semester course on this type of trauma and ACEs and how do you integrate that into your own practice. Court systems are starting to do it, police departments. And then I'm going to talk about how we are starting to do it at the Health Council. So I came almost 2 years ago and I talked to our CEO about ACEs, and because I've been into the research. I did it when I was in Iowa at the hospital I was at, and I went to him with it and I said, we need to do this presentation for all of our providers. They need to know this information. It's so important. And he's like, well, yeah, maybe. And so a year goes by, we talk about it. I played the Nadine Burke video for all of them, and I'm still in his office. I'll go in every now and then. I'll say, we need to do this. We need to screen for it. Well, time passed, and this last year we had a all staff meeting where all of our staff were there. He did make it where it's mandatory, where we will have, starting February 1st, we're going to start having all of our providers screening for ACEs in 19 and older, and all expecting mothers of any age. And we have a plan in place of how that's going to roll out. And so I gave a template of how we did it. So I trained all of our staff in ACEs and trauma, and then we're going to go to each clinic and do each individual clinic differently. We're going to have the nurse go in and give the ACE questionnaire to the patient, and they're going to look at it. And then when the provider comes in, the provider will ask their score, because simply even asking, how has this impacted your life, is an intervention in itself. I put the resource on here, but they found in one study that just simply asking, how has this impacted your life, 11% decrease in ER visits, 35% decrease in primary care visits, and 3% decrease in hospitalizations. And it's because it's simply just validating. validating that this isn't your fault, and helping them connect to maybe why they're doing what they're doing. And then just simply making the appropriate referral. One of the main concerns for our providers was we don't have enough behavioral health services. And so then I went back and talked and said, well, we don't have to refer every patient to behavioral health, and simply just asking, how has this impacted you? Right there's an intervention in itself, and a lot of people are very resilient. Like Dr. Nadine Brooks said, it's common. It's common for people to have ACEs. So a lot of people have experienced trauma, but they're very resilient. So then figuring out what did they do to get through it is very important. And not only behavioral health would be a referral, but just dietitian, fitness center, and just educating them on sleep and exercise, and just sort of what they're already doing and you're already doing when you have your main visit, and going from there. And then I do have this case example. I have many case examples I could share. And this is a common theme. So the child gets referred to me for behavioral health, for behavior problems in school or at home. And we do an ACE score for the child. And then we also do one for the parents at our pediatric clinic. We've been doing that for over a year now. And for this case in particular, the parent had a score of 8. So then educated them on the ACEs study, and it made complete sense to them. And Dr. Ionis and I could go story after story, sharing, doing the ACEs with the parent, talking to them about what this means, talking about why this could be why your child is acting the way they are. We refer the parent to counseling, and then the parent meets and does their own therapy, works through their own attachment problems. And then we generally see the child improve drastically, or we have to do a type of therapy where we involve the parent and the child together. This is very common. And like I said, just the research coming out on pregnant women and how that impacts their babies. And then I have adults, I also do psych testing with adults, and I have, for this case example, presenting concern with attention and focus with depression, and then through psychological testing, through the interview, and just through the assessments that I gave, ADHD was not the diagnosis. Easily could have been diagnosed if we just would have done like a Vanderbilt and a few questions, but through more clinical interviewing and assessment, this patient had extreme trauma and neglect through childhood, gender dysphoria was coming out, and then high dissociation. And then questioning, so high dissociation can look like inattentive ADHD, because you're that zoning out, you're in a daze, spacing out. There are patients who do have ADHD and PTSD, but a lot of times if any of my referrals have childhood trauma, neglect, and it hasn't been processed and worked through appropriately, I won't give an ADHD diagnosis. And these are just some quotes from ACEs Too High. ACEs Too High and ACEs Connection are two really great resources if you want to learn more about ACEs and look into what people are doing. I think they even have different groups for like medical, pediatric. I don't know if they have like residency programs and things like that on there, but there's a lot of them. Schools, education. And these are the main treatments that I refer to for counseling with people who've had a trauma, attachment. Comprehensive psych assessment is crucial, but it's not for every patient. I think for kids it's so important because then you can figure out what's going on before you put a medication on them, and you can figure out if counseling works before putting a medication on them. And again, Dr. Ionis and I have many case examples where if we wouldn't have done psych testing, they wouldn't have had the proper treatment. They would have probably been given a stimulant, and it wouldn't have turned out the way some of ours have. EMDR, I'm trained in that. Are you guys familiar with EMDR? So it's a type of treatment that was, in the early 90s, they used it mainly for trauma, and it's mainly used for trauma, but there's research coming out now. It's effective for substance disorders, depression, anxiety, eating disorders. So it's different because you're using bilateral stimulation movement. So you're integrating the brain. So you're doing right brain, left brain to integrate the trauma that happened. So a lot of times trauma gets stuck in that right brain emotional part, and you have to process emotions where you feel it in the body before you can actually talk about it and logically think about it. So just simple talk therapy isn't really effective for anybody who's had complex trauma attachment disturbance. So a lot of times I'll do EMDR and TheraPlay together. I'll do that a lot with children. So TheraPlay is for attachment and it's involving the parents. Do you guys want to watch a little video? It's like 2 minutes on EMDR.
Yeah.
I think I tried this last time and it didn't work, so we'll see. I think this is it. Yep.
I handled traumatic events for many, many years.
For so many years, I had suppressed emotions and hadn't shared those very candidly.
I've lost a lot of people. People have died. Everybody pretty much has gone.
A fight ensued where they used material to wrap around my neck to choke me. I was struck in the head multiple times.
Well, you don't want to tell everybody that story because not a lot of people will understand.
I'd like to be able to have the relationship now that I couldn't have then.
You want to be an adult with your mom. Our brain is a very natural healing mechanism, very much like the rest of our body. We want to heal.
When you have depression or any kind of ailment like PTSD, you don't know if it's ever going to get better or if you're going to have to resort to medication.
I was ready to give it all up.
EMDR psychotherapy is one of the 5 recommended treatments for trauma by the American Psychiatric Association.
The firefighter next to me got hit and killed. The other civilian got hit and hurt. The survivor's guilt that came with that was awful.
And yet, it's not just for trauma. EMDR psychotherapy is tremendously helpful for adverse life experiences.
I'm laying in bed and I'm thinking, I can't do this. There's no way. I'm not prepared. I don't look right.
It's very hard to stand up and tell somebody how you really feel.
When I was first exposed to it and sat one-on-one with my clinician there, I thought he was silly.
He said, do you have an image of this person now? And I said, yes, I have an image of this woman. I tried to hold on to that image during the EMDR episode. To me, it was as if somebody holding a picture of the person and pulling it away into a dark corner of a room. Tears started to stream down my face, and Ed says, what's wrong? And I said, this is amazing.
I felt that sense of release, of freedom.
It just gave me the freedom to really express myself.
Put a giddy up in my step.
And I told myself, no, this is not who you are. You know you're stronger. You know you have it in you.
Something changed the first time I had EMDR. And if I could put one word to it, it'd be hope.
My first session was very, very powerful.
I thought it was magic at first.
EMDR psychotherapy is more akin to what happens during REM sleep. When you go into sleep and your brain kind of sorts things through and lets go of stuff that it doesn't need, it's a very similar mechanism. EMDR can help us go back to when the root was laid down for a negative belief system.
I want to do EMDR again.
Do you?
If you can get out of this career 25 or 30 years healthy, that's a victory on its own.
I've heard so many stories of growth and healing.
I just kind of stepped out on the porch and I went, wow, the sky was bluer.
I don't think I'll ever be 100%, but I've definitely come so far.
We really give people their lives back as therapists, and that's profoundly important to me.
Yeah, it's brief, but I've been doing EMDR for a few years now, and I've seen amazing results with it. It's just you can't just do talk therapy with people who've had extreme trauma, neglect, or even trauma events. And EMDR could be 2 to 3 sessions for somebody who had one major trauma, like a car accident, and they can't get in the car. And I mean, EMDR could work through that rather quickly. Somebody with complex trauma and then have other traumas as a teenager, adulthood, I mean, it takes more sessions, but it's been amazing. And then with kids with extreme trauma and neglect, TheraPlay and EMDR has been very effective. So that's it. You guys have any questions?
Do we have access at all to your presentation?
You should. If I've emailed it out, and if you don't, just email me and I'll send it to you.
Wonderful. Thank you.
You're welcome.
Have you ever had any, difficulty with patients not wanting to answer the questionnaire? You know what I mean?
Yeah, I do. So in the year and a half that the PEDS clinic's been doing it, because they have the parents do it themselves and they'll have them do it on their child. there's maybe been 1 or 2 parents who kind of got defensive. A dad said, "Why are you having me do this? This isn't on me. This is for my kid." And then one other time where a mom started crying because it triggered some stuff within her. But no, oh my gosh, we have parents, and I mean, Dr. Ionis and I, she would tell you this, you guys know her, she would say it. She was hesitant to do this at the peds clinic, and then after we talked about it and she started doing it, she's completely on board for it and wants to do more research on it. And yeah, we have a really good process in place. Usually if it's 4 or more and there's behavior problems, we refer to either behavioral health, psych testing. And if like 1 to 3 with no symptoms, we just talk about it, or 1 to 3 with symptoms, so like that stress response, then we make a referral. Yeah, no, in adults, never. I've never had one adult. Actually, I've had the opposite. That it supports the research they did find. It's very validating. And then they want to end up going to counseling to work through it, or they work on their own health differently, just a completely different mind state. Yeah. Mm-hmm.